largely because of the outbreak at one nursing home.
The Canterbury Rehabilitation and Healthcare Center in the West End is the epicenter of this public health crisis in Central Virginia. More than 30 residents have now died from the coronavirus, and more than 100 patients and staff members have tested positive. Tonight, a problem solvers investigation. Our Melissa Hippolyte explores how the situation turned so quickly at one nursing home.
Kathy Campbell moves determined yet nervous.
John, are you there?
Toward her brother's room at Canterbury Rehabilitation and Healthcare Center in Henrico.
Somebody's going in there to open up the curtains for me.
He suffers from Huntington's disease, but the facility is no longer allowing visitors.
Is he doing okay?
All because of the words that Kathy is about to hear.
Did he test positive? He did? Is he showing any signs? No? But he is positive. God. Babe, we love you.
61-year-old John Kozak is now one of more than 100 patients at Canterbury who have tested positive for COVID-19. 32 of them have died so far. As the virus has spread, loved ones on the outside say they feel helpless.
I'm just praying that at some point it just stops and people will be okay. We know that that's not going to be the case, but that's all I'm praying for.
But how did Canterbury get here? Was there anything that could have been done to prevent this outbreak?
We know that this is an extremely difficult time for the residents of Canterbury Rehabilitation and Healthcare Center.
The head of the Richmond and Henrico Health Departments, Dr. Danny Avula, says testing failures are to blame.
The severe lack of testing and the turnaround on testing time at the very beginning of this might have contributed to a scenario where there was a lot of disease spread before we even knew this was COVID-19 in the facility.
To that point, a timeline provided to us by Henrico County shows emergency calls to the facility over the past several months. 911 calls there started going up in February, skyrocketing by the final week of the month. But the first case of COVID-19 was not officially confirmed at Canterbury until March 18th. Yet, testing of every single resident and most of the staff at Canterbury was not done until the week of March 30th. County Manager John Vitolkis says the county even offered the facility tests the previous week, but Canterbury declined.
Had that been done, I think that perhaps we would have had results sooner and been able to act, have all of the providers act quicker. So there is a lesson learned.
Another issue, protective gear. And at Canterbury right now, do all of the staff have PPE, knowing how spreading this, how far this has gone there?
They're using N95 masks for more than one day at a time. They're using cloth masks to cover their N95 masks to increase the lifespan of those. It's an extreme challenge because we don't have enough disposable PPE to do that, so we're having to adapt these crisis time solutions.
In fact, Avula says because of the PPE shortage, the practice had been to only use that gear with patients showing symptoms. And because of a staff shortage, VDH allowed staff that had no symptoms but may have been exposed to continue working. But now health officials recognize plenty of people can have the virus without feeling sick.
Hey, John. Honey, we're not allowed in. I can't come in.
Which is the case with more than 35 residents at Canterbury, like John Kozak.
We just pray every day that at least he's getting care and will be treated with dignity and respect.
The question now is, can this be prevented at other long-term care facilities in the area? One danger is the fact some staff members work at more than one nursing home. Is it safe to say in Henrico and Richmond right now, staff are not going from place to place? They're all staying at one facility?
I don't think I can say that 100%. We have also, shared our concerns with the state, and the state is actively thinking, is there an order, a public health order or mandate we need to put in place to keep staff from moving from facility to facility?
But staffing needs at these facilities will make that tough, especially now that there are 7 other COVID-19 clusters in this district. So Avula says he's recommended facilities test all residents, even if they have no symptoms, so positive patients can be isolated ASAP.
I love him more than you'll ever know.
To hopefully prevent what happened at Canterbury from happening elsewhere.
Honestly, I never thought he would ever be in this situation that he's in right now.
Oh, God.
We asked Canterbury about why they initially declined the county manager's offer to provide testing assistance. The administrator of Canterbury did not respond directly to that question, but did say ever since the first COVID-19 diagnosis at the facility, they have been working in lockstep with the Henrico County Health Department. Working for you, I'm Melissa Hippolyte for CBS 6.